Good morning, good evening once again. This is Jody, your Grandison Espresso Lounge host. And for tonight, we do have a very special guest from one of our partners in the United States. So let's all welcome Travis. Hello, Travis.
Hey, good afternoon, good night. For me, it's good morning, but yes, very excited to be on. Thank you.
Yep. Thank you so much for guesting or for blessing Grandison Espresso Lounge with your presence for tonight. And by the way, Travis, before we proceed with the interview, before we get to know your facility, Sigma, can we know or can you introduce yourself a little so that our viewers can get to know you as well?
Yeah, Travis Womer. I'm a physical therapist. I'm the corporate director of reimbursement, operations, and development for Sigma Health Rehab. Also navigate with Centers Healthcare.
Yep. So thank you for that quick introduction, Travis. So you mentioned Sigma, Rehab, right? Can you tell us more as well about who Sigma Rehab is and, what do you think? I'll go straight to the point. What sets apart Sigma from other skilled rehab centers in the United States?
Yeah, that's a tough question. I think that there's a lot of different things, similarities with rehab departments across the United States, obviously from just the various models that have make up. I can tell you one of the things that I'm very, why I'm proud to be a part of Sigma and why I think that Sigma is much more of a unique entity, comparatively speaking, to staffing agencies out there. Sigma, I do believe, and I know to be true, is, it's not just a generic rehab company. Our policies, procedures have been individually curtailed to create just a reflection of what we are as a corporation, a company, and the type of therapy and the environment that our therapists are engaged in. It's nice because we do work fairly synonymously with Centers Healthcare, and because of that experience, we're really able to offer virtually the same experience in almost every clinic that we have. So it's very individualized in terms of what we want from a quality standpoint and from an employer. We really want our therapy teams and any member of Sigma Health Rehab to be, happy. That's first and foremost. You can't accomplish your goal and facilitate the healing culture and process with a patient if you're in an environment that you're unhappy as well.
Yeah,
Um,
I agree with that.
and yeah, and we really do push education. There's, as a whether you're just coming out, as a new grad to the profession, or you're 10 years down the road, there are elements of maturation, change, evolution within our industry. And a part of our, foundation is education and evidence-based practice and keeping up with that process. So we do pride ourselves in that. And, you know, we we are just a very unified company, to be honest with you.
Yeah. Thank you for that, Travis. And I guess that speaks a lot about Sigma, the way you have described it. And I don't know, we do have a lot of physical therapies right now, that I can say is assigned in Sigma Rehab right now. And with that said, can you tell us as well what states are you servicing right now aside from New York or New Jersey, and what types of patients do you cater to? And how many
Yeah.
clinics
So,
does Sigma have right now?
well, Sigma is it's tough because, truth be known, Sigma does represent some other entities outside of Centers
Mhm.
Healthcare. The facilities that I directly are responsible for in terms of operations are, within the Centers Healthcare network. In terms of the states that Sigma represents outside of New York and New Jersey, um, to be honest with you, I don't even want to speculate because I'm not 100% sure. Some of the other entities, I can only speak on the behalf of, what we navigate with centers. I can say in New York State, we are the largest provider of skilled nursing, subacute rehab within the state of New York. We have the largest footprint. Um, and what was the other question you had, Jody? Sorry.
Yeah, what type of patients do you usually cater to in Sigma as well?
I think that that is an interesting question, in terms of the state of affairs with skilled nursing. The
Mhm.
stigma is, you're going to a nursing home, you're going to skilled nursing, subacute rehab, and you're looking at a geriatric population. And
Yeah.
that has vastly changed in the last 10 years. I'm 14 years into this in a career with centers and Sigma, um, and the patient population and how we view skilled nursing and subacute rehab has completely changed. 10, 15 years ago, you would have thought, 80, 90% of our patient population is geriatric, and that is not the case anymore. In the American medical model, we were really seeing a push of hospitals to decrease length of stay. And in doing so, they're kind of triaging in terms of the continuum of care, meaning that, whether they're going to a subacute rehab facility, or whether they're going to an inpatient rehab facility, outpatient, home care, that's the continuum of care that I'm talking about.
Yeah.
And a lot of the HMOs, insurance companies, and hospitals really getting back to it is trying to, decrease that length of stay for the quality of care standpoint for the patient. And as a byproduct of that, we are seeing a very a versatile um, group of patients, meaning that we'll have a 30-year-old resident with, neurological deficits, cardiac issues at, 45 years old, um, orthopedic issues at 30 to 60. I mean, our patient population and demographics have completely changed probably within the last 6 years.
And that's very
So
interesting because initially what we were expecting is that Sigma would have been catering to like majority would be geriatric patients. So it's very interesting that you're telling this that as now as well.
I actually think it's it's
Mm-hmm.
probably one of the fulfilling. I mean, I'm biased, but if you're really looking for a big experience in terms of, clinical diversity in a patient population, you get that in the subacute rehab building. Now, don't get me wrong, there are, nursing homes and skilled nursing facilities out there that, really do, depending on the geographical location, they're not necessarily seeing that clinical diversity. But, in larger markets, you absolutely are exposed to a very wide spectrum of patient
Yeah.
population clinical presentation.
Yeah. And speaking of geographical location, Travis, how many buildings do you oversee right now with Sigma?
Yeah, I sent you the list. To be
Uh,
honest with you, it's growing. I don't know, what was it, like 23, 26? I really couldn't recall. But that's throughout New Jersey and New York. I don't keep tallies, it's just
yeah.
we 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 don't base our performance based on numbers of that nature. It's just, based on the outcomes of the patients that we have in our buildings.
Yeah. And given the 14 years that you've been with Sigma or you've been in the industry, Travis, can you like tell us more about what are the biggest challenges that you're facing right now in terms of the PT care or PT manpower in the United States?
Yeah. Um, I mean, I think any medical professional in the state of affairs right now in the United States medical model is going to say staffing. That's kind of the constant variable that everybody's trying to overcome. Um, and I attribute it to a little bit of competition too, because, it's kind of holding the employers accountable to create a better work environment for their internal staff. And, you not only want to market and bring in medical professionals, that being physical therapists, occupational therapists, speech therapists, but you have to create an environment that they're staying within your network and they're happy. So retaining your direct hire staff is really pivotal to overcoming that problem. And to be honest with you, we have, and I don't want to toot our horns, but like we really are kind of an aberration in terms of the staffing world. Um, we have been very successful in retaining our in-house population, our direct hire staff. You know, I'm not going to tell you like every 100% of everybody is happy. You know, sure there's issues out there, but we are the first person to jump on board and say, let's, collectively try to overcome it.
Yeah.
The other thing that, I think any new therapist in general would want to know, in terms of issues, it's the ever expanding nature of managed care, auditing, you know, documentation to substantiate the skilled services that any professional is providing. Um, it's kind of the cat and mouse game. We do bill for services, and the insurance companies, Medicare, managed Medicare, commercial insurances, they want to validate and substantiate that the services that anybody is billing for is, warranted. So a lot of education from our standpoint to empower our staff members, our therapists, to make sure that not only are they providing services that they autonomously feel is skilled, but teaching them and providing and giving them the resources to know how to document for those services for them to hold up in any
Yeah.
for them to hold up in any type of audit,
Yeah, for
or
them to like really succeed in their roles as a physical therapist in the United States. And when you mentioned staffing earlier, Travis, can we know as well how long have you been working with Grandison, and how is Grandison helping you address these challenges that you mentioned earlier?
I can honestly tell you, I'm fortunate enough to tell you that as a new grad coming out, I really have been working with Grandison my entire career.
What do you hear?
Back in 2010, 2011, um, I've really have been, we've worked together. It's not that I've really worked with Grandison. I think the Grandison works with us as well. Was a symbiotic relationship, to be honest with you. They've grown, we've grown. We would not have the footprint and we would not have the identity if it wasn't for Grandison. Um, I was talking to Avi the other day, and it was very interesting because I was actually self-reflecting on our departmental makeup, and I would be willing to place a wager. We're the largest provider of skilled nursing facilities in New York State, right? And at least 95% of every one of our departments either currently have a Grandison therapist, or we have a Grandison therapist that have completed their contract that has wanted to maintain employment and continue to transition under a direct hire employment with Sigma Health Rehab. And we're grateful to have them, to be honest with you. Anybody, it's they're a part of us sometimes as a third party vendor that Sigma Health is. We you think of agency therapists, and that's not the case with Grandison. They're a part of us, that agency. And yeah.
Yeah, and I think prior to this interview as well, Alisa also told me that like there's like 25% to 30% of the PTs who have been assigned with Sigma, they are really being absorbed or being directly hired by Sigma after their contract with Grandison. And that speaks a lot in terms of the things that you mentioned earlier in terms of taking care of your PTs, your employees per se. And I think with that said, Travis, for newly hired Grandison PTs, for example, once they have been assigned to Sigma, can you like give us a quick overview of what they can expect for like the first 2 3 months of their arrival to your to your facility?
Yeah. I mean, we have a full new hire orientation, program. And it's not to isolate Grandison. New direct hires go through the same process. And part of that orientation is obviously going through your job descriptions, understanding the operations of the building that you're in, individually, because there's going to be much different leadership teams in every building. And the inner workings of that building is usually unique. Outside of that, then we have a full orientation program that covers, kind of like a skills check off, to an extent, going through all of our policies and procedures, and the ones that we deem, necessary. There are competency, check offs that, it's not like a pass fail in terms of, hey, you're not eligible to work for us if you're not at this level. It is okay, let's assess like where your weaknesses are and let's assess where your strengths are. And it's a 90-day process that we'll go through. And maybe you need a little bit extra education and resources and training and documentation. Maybe you need, a little extra time in some of the modalities, such as e-stim, ultrasound, the units that we have within our department. Maybe they're completely different than the ones that you trained with in school. So let's work on that. We have a supervisor that you can bounce ideas off of. It's very constructive. We're not out here. It's not geared to be punitive, but it's really geared towards after your 90-day mark, you're at the same caliber of a therapist that anybody else is within this company and within this department.
Yeah. And given that you've already worked with a lot of Filipino PTs there, Travis, what can you
Yeah.
say about the Grandison PTs that were working with you together? They're working with you within Sigma.
They're kind of family, to be honest with you. I mean, they're yeah, I mean, I throughout my career, I have seen, Filipino therapists come through Grandison. And to be frank, usually, somebody that therapist comes over independently, which I've always been, my hat's off to them in respect. I think that going off to college is as an American therapist, U.S. Based therapist is nerve-wracking in and of itself. And then you have, that same therapist going to a different country. I mean, I have an immense amount of respect for that.
Yeah.
And in many cases, their families are, over in the Philippines. Um, but I've seen the entire transition with, they stabilize, they assert themselves as, a contributing, very competent member within that department. Their families then come over. They create a family within that community. And more times than not, especially in upstate where I see, they transition right into a direct hire employee of Sigma Health. I mean, I can tell you a handful of, therapists and families that I can mention their children's names, the birth of
Wow.
their children,
Yeah.
and the growth of their families. Um, in a couple different scenarios, believe it or not, like I can tell you therapists that have met their husbands or wives within that department and that experience. Now they're happily married, looking to start their own families here in the United States. I just, again, I'm going to say it, that they're family, just like any other employee of Sigma Health.
Mm-hmm. And since you mentioned being a direct hire employee with Sigma, Travis, is there any chance of promotion as well for these PTs once they have been absorbed or once they have been directly employed by Sigma in the future as well?
Yeah, I mean, listen, the way we work and the way we look at it is we always want to put the best person in any type of, leadership role to, you know, right the ship, to drive that ship. Um, and if they are, if they're a United States therapist, then they're a United States therapist. If they're Filipino, they're Filipino. If they're from Mexico, they're from Mexico. It doesn't matter. We have had a number of instances in which a Grandison therapist is the best person for that director's role. And they have transitioned into that director's and role. And to be honest with you, flourished, has been one of the best directors and currently like some of the best directors we have within our company. But we everybody has an opportunity, to advance. I think it's just that in any game,
A
who
scenario for
takes
everyone, yeah.
wants that opportunity to evolve. To your point, it's not for everybody, but
Yeah.
yeah.
Yeah. And I guess Travis, I'm down to my last question actually. But before that, thank you once again for joining us tonight here in Grandison Espresso Lounge. And the very last question that I have for you is really for the PTs who are watching right now or listening to our live interview right now. So, do you have any message to aspiring Filipino PTs or Filipino RPTs, and maybe like invite them to sign up with Grandison and join Sigma possibly in the future as well?
Yeah. I think there's a lot of outlets. Again, I'm biased. I think Sigma is a great opportunity, to any new therapist in general. I really I encourage everybody to look at the experience and the opportunities for your first placement, first job, right? I mean, a lot of times I see people really focused on, money, and that's not necessarily the best, position and platform to leapfrog your career. It is the experiences and what you're going to be learning to position yourself for your second, third, fourth job from there on out. That's one. And the other thing too is, make sure you're affiliated and you're aware of the associations and resources you have to assimilate into the American medical model for skilled nursing, right? So the American Physical Therapy Association, they do a really good job. There's a skilled nursing facility special interest group underneath the geriatric section. They should have a lot of good resources. And, within that population, feel free to reach out to professionals like myself, people within the APTA, that skilled nursing facility, special interest group under the APTA piece. Reach out to them, like ask questions, bounce ideas. If you're feeling uncomfortable, um, again, position yourself appropriately in terms of the experiences.
Yeah, thank you so much, Travis. That's very well said. And I hope our PTs learned something tonight from you and from Sigma as well. So once again, thank you so much, Travis. And that wraps up our question for tonight's Grandison Espresso Lounge.
Yeah, thank you, Jody. You have a
Yeah.
wonderful night.
Yeah. Thank you to Travis and have a good day there.
Thank you.
Yeah.